Are your daily movements killing your neck? You perform 5 innocent gestures every day without realizing that each one is silently destroying your cervical vertebrae and accelerating chronic pain that can become permanent after age 60. I'm Dr. Anna Hope, a physician specializing in geriatric orthopedics with over 15 years of experience specifically caring for the bone health of elderly patients. Today I'm going to reveal what these 5 apparently harmless movements are that 67% of seniors perform daily without knowing they're destroying their own necks. And this revelation will shock you completely. If you're over 60 or know someone in this age range, leave in the comments right now, "I didn't know this," so I know you're paying attention to this information that can save your joints. Because by the end of this video, you'll discover not only what these deadly movements are for your neck, but also the secret limit that most people exceed every day, causing silent degeneration that only shows up when it's too late to reverse. The first thing you need to understand is that aging doesn't just happen in the skin that wrinkles or hair that turns white. It happens silently inside your joints, and the neck is one of the most vulnerable regions after age 60. Studies show that 85% of elderly people develop some type of cervical degeneration, but only 30% notice the symptoms before the situation becomes irreversible. The first deadly movement you probably did this very morning is something so simple it doesn't even cross your mind. Looking down to read on your phone or tablet. This apparently innocent gesture forces your cervical vertebrae into a position they weren't designed to support for long periods. When you tilt your head 15 degrees downward, the weight your cervical spine needs to support increases from 5 kilograms to 12 kilograms. At 30 degrees, which is the normal inclination when we read something on a table or in our lap, that weight jumps to an impressive 18 kilograms. Imagine carrying an 18-kilogram backpack hanging from your neck for hours every day. That's exactly what your cervical vertebrae are supporting every time you make this movement. And here's the terrifying detail. After age 60, intervertebral discs lose up to 20% of their impact absorption capacity, and the ligaments that keep your vertebrae aligned become 35% less flexible. But the problem goes far beyond weight. When you keep your head tilted downward, you're creating uneven compression in the cervical discs. The front part of the disc is squeezed while the back part is stretched beyond the natural limit. In young people, this distortion is temporary. But after 60, when the disc has already lost much of its natural elasticity, this deformation can become permanent. And there's an even more sinister aspect. This inadequate position doesn't just affect the discs. It forces the posterior neck muscles to work constantly in contraction to prevent the head from falling further forward. These muscles, especially the suboccipitals at the base of the skull, weren't designed to work in constant tension. Over time, they develop chronic tension points that can cause debilitating tension headaches. The second destructive movement is even more common. Turning your head sharply backward to look at something. Seems natural, right? You're talking to someone and need to look back, or you're driving and need to check the blind spot. But this sudden rotational movement in people over 60 can cause micro-injuries in the soft tissues of the neck that accumulate over time. The problem is that most people make this movement with excessive force, especially when they're in a hurry or anxious. Cervical rotation in elderly people should be limited to a maximum of 45 degrees on each side, but most force up to 70 or 80 degrees, creating tremendous pressure on the facet joints. These small joints that connect your vertebrae begin to develop premature arthritis, causing that morning stiffness that many incorrectly attribute to how they slept. But there's a technical detail that most doctors don't adequately explain. When you rotate your head more than 50 degrees, you're putting the vertebral arteries under mechanical tension. These arteries pass through small tunnels in the cervical vertebrae and are responsible for carrying blood to important parts of the brain, including the balance center. In older people, these arteries may already have some degree of narrowing due to age. Sudden rotational movements can temporarily compress these arteries, causing dizziness, imbalance, and even falls. The third movement that's destroying your neck occurs when you lift heavy objects without maintaining the natural curvature of your neck. Most elderly people when they go to pick up something heavy from the floor or a high shelf, project their head forward, creating compensatory cervical hyperlordosis. This movement places tremendous pressure at the base of the skull and can cause chronic tension headaches. What makes this even more dangerous is that after age 60, the deep neck musculature, specifically the suboccipital muscles, loses muscle mass and support strength. When you force these already weakened muscles with inadequate lifting movements, you're creating a vicious cycle. Pain, muscle compensation, more pain, more compensation. Here's a fact that will surprise you. Recent research shows that 42% of headaches in elderly people aren't caused by neurological problems, but by dysfunction in the cervical musculature caused by inadequate repetitive movements. And most doctors don't even investigate this possibility, focusing only on pain medications. The problem is that when you project your head forward during exertion, you're transferring the weight of the object not only to your back and arm muscles, but also to the cervical structures. It's as if you were using your neck as a counterweight, and the heavier the object, the greater the force that the cervical vertebrae need to support to maintain stability. The fourth deadly movement is sleeping with inadequate pillows or in positions that keep the neck twisted. You spend approximately 8 hours per night in this position, which means that 1/3 of your life, your cervical vertebrae may be being slowly tortured. Pillows that are too high or too low force unnatural curvatures that, over years, create permanent deformities. The problem worsens because after age 60, sleep becomes more fragmented, and many elderly people end up sleeping in compensatory positions to try to relieve other pains, like hip or shoulder problems. These compensatory positions place the neck at dangerous angles for consecutive hours, and there's a technical detail that few know. During REM sleep, which is when we dream, our muscles become completely relaxed. If the neck is in an inadequate position during this phase, there's no muscular protection, and all the weight of the head falls directly on the cervical joints. This explains why many people wake up with neck pain, even without having done any physical effort the day before. But that's just the surface of the problem. What I'm going to reveal now about the fifth movement will shock you, because it's something your own doctor probably recommended. The fifth devastating movement for elderly people's necks is something that seems completely healthy. Cervical stretching exercises done incorrectly. Seems ironic, doesn't it? You're trying to take care of your health, but you might be accelerating the degeneration of your cervical vertebrae. The vast majority of stretching exercises recommended for elderly people don't take into consideration the anatomical changes that occur after age 60. Ligaments become less elastic, muscles lose mass, and articular cartilage decreases in thickness. When an elderly person performs forced rotation movements or excessive neck flexion, especially those exercises where you roll your head in complete circles, they're creating repetitive microtraumas that accumulate. The problem is that these microtraumas don't cause immediate pain. On the contrary, often the person feels temporary relief due to increased blood circulation. But in the long term, these movements are causing chronic inflammation in the facet joints and can even cause small fissures in the intervertebral discs. Here's an alarming fact. 38% of cervical disc herniation cases in elderly people are related to inadequate exercises, including stretches done without professional supervision. And the most terrifying thing is that many of these exercises are found in internet videos or were taught by professionals who don't have specialization in geriatrics. This is a story that few know, but perfectly illustrates the hidden danger of these apparently harmless movements. 3 years ago, I received in my office a 67-year-old patient named Maria. She was suffering from intense cervical pain that radiated to her right shoulder, causing tingling in her fingers. What struck me most was that Maria was extremely active, exercised every day, walked, did water aerobics, and religiously followed a stretching routine she found on a YouTube channel. Maria's exams showed something that left me perplexed. She had a disc protrusion at C5-C6 that was compressing the nerve root, but the strangest thing was that there were no signs of significant arthritis, as would be expected in someone her age. It was as if the disc had been damaged by repetitive trauma, not natural degeneration. When I began investigating more deeply, I discovered that Maria had been doing daily for more than 2 years a sequence of cervical exercises that included complete head rotation, forced flexion to touch her chest with her chin, and maximum extension to look at the ceiling. She did these movements thinking she was preventing neck problems. What Maria didn't know is that these movements, especially complete head rotation, create shearing in the cervical structures that can be extremely harmful to elderly people. The vertebral artery, which passes through small openings in the cervical vertebrae, can be compressed during these movements, causing not only pain, but also dizziness and even strokes in extreme cases. But Maria's case revealed something even more concerning. When she stopped doing the inadequate exercises and began a protocol specific for her age and condition, the pain decreased significantly in just 3 weeks. This proved that a large part of the problem wasn't irreversible degeneration, but inflammation caused by inadequate movements. The most shocking thing was discovering that the video Maria followed had over 2 million views and hundreds of comments from elderly people reporting initial improvements. What they didn't know is that these temporary improvements were followed by more serious problems months later. It was like a time bomb. From that case, I began investigating more deeply and discovered something the fitness industry doesn't want you to know. Most neck exercises taught to the general population are based on studies done with young people and athletes, not with elderly people. The cervical structures of a 30-year-old person are completely different from those of someone 60 or 70 years old. The discs are more hydrated, ligaments more flexible, and there's much greater muscle reserve. Applying the same exercises to both age groups is like using the same medication for a child and an adult. It can be dangerous. And here's the most terrifying detail. Many physical education professionals and even physiotherapists don't have specific training in anatomo-physiological changes of aging. They apply generic protocols that may be causing more harm than good. A study that few know about, published in the Journal of Geriatric Physical Therapy in 2019, followed 200 elderly people for 2 years and discovered that those who did cervical exercises without specialized supervision had 60% more chance of developing chronic cervical pain compared to those who didn't do any specific neck exercises. And these 5 movements have something in common that can transform temporary discomfort into permanent deformity. There's a hidden limit that, once exceeded, has no return. What connects all these 5 destructive movements is something we technically call cervical compensation threshold, an invisible limit that, once exceeded, triggers a cascade of irreversible problems. And here's what's really terrifying. Most people exceed this limit every day without realizing it. Let me explain in simple terms how this works. Your cervical vertebrae work as an integrated system. When one segment is overloaded, say by tilting your head to look at your phone, the neighboring segments try to compensate for this overload. This works well when you're young and have healthy structures, but after age 60, when discs are dehydrated and muscles weakened, this compensation creates a destructive domino effect. The problem is that this compensation is silent in the early phases. You can spend months or even years exceeding this limit without feeling anything. But when symptoms appear, the damage is already established. It's like a bank account in the red. You can keep spending for a while, but eventually you'll reach a point where you have no more credit. Biomechanical studies show there's a critical threshold of repetitive stress in cervical structures. For people over 60, this threshold is approximately 40% lower than for young adults. This means movements that would be harmless at 30 become potentially destructive at 65. And here's the cruelest detail. This limit progressively decreases with age. At 60, you still have a reasonable safety margin. At 70, this margin is drastically reduced. At 80, there's practically no margin for error. But what really concerns me as a physician is that very few people know this limit exists. They continue doing the same movements they did at 40 or 50 without realizing their cervical structures no longer have the same recovery capacity. I'll give a practical example that will make you understand the gravity of the situation. Imagine your cervical vertebrae are like pieces in a Jenga game. When you're young, you can remove several pieces without the tower collapsing. But as you age, each piece removed leaves the structure more unstable. There comes a moment when removing just one piece Making just one inadequate movement can bring the whole tower down. That's why so many elderly people report they suddenly started feeling neck pain out of nowhere. Actually, it wasn't out of nowhere. It was the result of years of small accumulative traumas that finally exceeded the compensation threshold. And there's an even more concerning aspect. Once this limit is exceeded, it doesn't return to normal. The compensation capacity remains permanently reduced. This means movements that were previously tolerated now become problematic. Here's a fact that should be posted in every medical office. The 23% of elderly people who develop chronic cervical pain could have avoided the problem if they had modified their postural habits at least 2 years before symptoms appeared. But the current health system isn't prepared for this reality. Medicine is still very reactive. We wait for the problem to appear to then treat it. There's almost no primary prevention focused on preserving cervical structures in elderly people. And when the problem finally appears, conventional treatment is limited. Pain medications don't restore disc integrity. Injections may provide temporary relief, but don't correct the movements that cause the problem. Surgeries are reserved for extreme cases and bring their own risks. What really works is early behavioral modification. But this requires knowledge that few possess. You need to know which movements to avoid, how to adapt daily activities, what's the correct posture for sleeping, how to adjust work and leisure environments. And here's something that will shock you. There's a window of opportunity to reverse some damage, but it's narrow. If you're starting to feel morning neck stiffness or occasional pain at the end of the day, you might still be in time to avoid more serious degeneration. But if you're ignoring these signals and continuing with the same habits, you're rapidly walking toward an irreversible condition. But there's a secret time limit that can change everything. And if you don't know what this limit is, you might be condemning your neck to accelerated degeneration that has no return. The moment has come to reveal the secret limit I promised at the beginning of this video. And this information can literally save your cervical vertebrae from irreversible degeneration. This secret limit isn't measured in kilograms, degrees, or repetitions. It's measured in time. There's a maximum time your cervical structures can tolerate inadequate positions before damage becomes permanent. And this time is much shorter than you imagine. For people over 60, maintaining any position that forces the cervical vertebrae out of their natural curvature for more than 20 consecutive minutes already initiates a microtrauma process that accumulates. This means if you spend more than 20 minutes straight looking down at your phone, reading a book in bed, or working at a table with inadequate height, you're exceeding the critical safety limit. But here's the most terrifying detail. This tolerance time decreases by half every decade after 60. At 70, the safe limit drops to 10 minutes. At 80, it's just 5 minutes. And most people have no idea this countdown is always active. That's why so many elderly people develop cervical problems suddenly. In truth, they were exceeding this critical limit repeatedly, every day, for months or years. The neck was enduring silently until it could no longer compensate. And now you know why those 5 movements are so dangerous. It's not just the movement itself, but the time you spend doing them. Looking down at your phone for 5 minutes? Probably safe. Spending an hour browsing on your phone with your head tilted? You're slowly destroying your cervical vertebrae. The good news is that now you have the knowledge to protect yourself. Every 15 minutes, not 20, to have a safety margin. Stop what you're doing and move your neck to a neutral position for at least 30 seconds. It's a small time investment that can prevent years of pain and limitation. And if you're already feeling some of the warning signs I mentioned, don't panic. There's still time to reverse much of the damage, but you need to act quickly. Modify your habits today, not tomorrow. For pillows, choose one that keeps your head aligned with your spine when you lie on your side. For exercises, avoid movements that take the neck to movement extremes, especially complete rotations and forced flexions. For daily activities, always keep the 20-minute rule in mind. Remember, your cervical vertebrae don't warn when they're reaching their limit. They simply fail when they can't take it anymore. Don't wait for pain to appear to start taking care of yourself. And here's my promise to you. If you follow these guidelines religiously for 30 days, you'll notice a significant difference in your sleep quality, morning stiffness, and energy during the day. Your neck will thank you. If this video alerted you to something you didn't know, leave in the comments "Changing my habits today," so I know you're taking this seriously. And if you know someone over 60 who does any of these dangerous movements, share this video. You might be saving that person's neck from irreversible degeneration. I'm Dr. Anna Hope, and my mission is to help you age with health and dignity. Subscribe to the channel and hit the bell to not miss the next revelations about how to protect your health after 60. Until the next video.